Unit 18, the circulatory system anatomy. We'll look at Part A, heart anatomy, Part B, vessel structure, and Part C will be the major blood vessels. What about the heart anatomy? We'll also include the development of the heart briefly. Circulation involves two circuits. There's a pulmonary circuit that transports blood from the right side of the heart to the lungs and back to the left side. The other circuit is the systemic circuit. It transports blood from the left side of the heart to the body and back to the right side. Let's describe the anatomy of the heart using a square heart. The heart is a double pump. It has a right side and a left side. It has four chambers. The two upper chambers are the atria, plural for atrium, and the two lower chambers are the ventricles. The left ventricle pumps blood to the body. The right ventricle pumps blood to the lungs. Here's a horizontal section through a pig's heart. The ventricles have thick muscular walls. The wall of the left ventricle is thicker than the wall of the right ventricle. The atria have thin walls. The vessels transporting blood to the heart include the superior and inferior vena cavae. The blood is transported from the body to the right atrium. Pulmonary veins transport to the heart from the lungs into the left atrium. The vessels transporting blood away from the heart include the aorta, which transports from the left ventricle to the body, and the pulmonary artery, sometimes called the pulmonary trunk, transports from the right ventricle to the lungs. The blood flow within the heart begins with the right atrium. It flows into the right ventricle, out into the pulmonary artery to the lungs and back, into the left atrium from the lungs, into the ventricles, and then out through the aorta to the body. The heart has valves that prevent the backflow of blood during the cardiac cycle. The AV, or atrio-ventricular valves, separate the atria from the ventricles. They include the tricuspid valve between the right atrium and ventricle, and the bicuspid, or mitral valve, between the left atrium and ventricle. Semilunar valves include the pulmonary semilunar valve between the ventricle and the pulmonary artery, and the aortic semilunar valve between the left ventricle and the aorta. Here's a frontal view of a pig's heart. This is the left ventricle and the right ventricle. That's the left atrium and the right atrium. The aorta extends from the left ventricle. The valve between atrium and ventricle on the left side is the bicuspid valve, not shown too well here. Between the left ventricle and the aorta is the aortic semilunar valve. You can make out that valve. The interventricular septum is the wall between the left and right ventricles. Chorditendinae, these are threads of connective tissue extending from the edge of the valves into the ventricles. They prevent the valves from everting, from bending the wrong way during contraction of the ventricles. The heart has its own blood supply. This is called the coronary circulation. The general blood flow involves the left ventricle into the aorta, then from there into small coronary arteries. The coronary arteries then lead to capillaries within the muscle of the heart. Blood then flows through the cardiac veins into a structure called the coronary sinus, sort of a collecting sac, and into the right atrium. Let's look at some of the details of the coronary circulation. From the aorta, the blood flows through two major branches. The first is the right coronary artery, which supplies blood to the right ventricular wall. Branch also supplies to the back part, the posterior part of the left ventricular wall. Another branch supplies the SA and AV nodes and the AV bundle. I know we haven't mentioned these yet. We'll come to that when we look at cardiovascular physiology. The other major branch is the left coronary artery. It gives rise to a circumflex artery that travels around the heart. This artery supplies the lateral left ventricular wall. The other major branch of the left coronary artery is the anterior descending artery. It supplies the front of the left ventricular wall as well as the interventricular septum. Notice that we have now covered the right ventricular wall, that's from the right coronary artery, and the left ventricular wall, that's from partly the right coronary artery and partly the left coronary artery. After the blood flows through the capillaries in the ventricular walls, it then flows through cardiac veins to the cardiac sinus or coronary sinus into the right atrium. As the heart contracts and relaxes, a pressure within the wall develops. This is called an intramural pressure. The pressure changes during the heartbeat, so the blood flow through the coronary circulation changes. Coronary arteries empty during contraction and fill during relaxation, because when the heart contracts, it squeezes the vessels, forcing the blood out of the coronary arteries. So during relaxation, the vessels are allowed to reopen and blood flows into them. There are certain pathological changes that occur to the vessels of the heart. One is arteriosclerosis. This is a buildup of fatty deposits in the walls of the vessels. It may lead to inflammation. Another one is atherosclerosis, the buildup of scar tissue and calcium deposits in the vessel walls. This results from inflammation. Let's look at the development of the heart, because this will help you understand the function of the heart and the parts. In the embryo, the heart begins to develop in the lower part of the embryo, roughly in the middle. It begins as a pair of vessels, and very early they begin to pulsate, forcing blood from the bottom of the vessel to the top, that is, from the back of the embryo toward the head. As time goes by, the vessels fuse into a single vessel, and they continue to pulsate, so the blood continues to flow. At this time, not many blood vessels have developed, so the blood is flowing within pools of blood in the embryo. The vessel then bends into an S shape and finally assumes the final form. Notice in the two-vessel stage, the blood enters the bottom and flows out through the top, but in the final shape of the heart, the blood essentially enters at the top and flows out from the bottom because of the change into an S shape. Internally, the heart is divided into four chambers by walls called septa. An atrio-ventricular septum forms to separate the atria from the ventricles. The valves will form within that wall. An interventricular septum will form between the left and right ventricles, and a partial interatrial septum forms. It ends up with a valve-like hole called the foramen ovale. Eventually, as you will see, the foramen ovale will close. Sometimes these walls fail to close, leading to a birth defect. One condition is a ventricular septal defect, a so-called hole in the heart. So when someone says, oh, I have a hole in the heart, It doesn't mean there's a hole in the wall, the outer wall of the heart, and blood is leaking out. It means the hole is in the septum, the wall between the ventricles. Now, when that happens, it decreases the efficiency of blood flow because blood is able to flow from left to right and right to left in the ventricles. Another is an atrial septum defect in which the atria fail to close. Again, blood can flow between the two atria, impacting the flow of blood to the body and the lungs. Let's look at the fetal circulation and the changes that take place at birth. For reference, the adult features are also shown. For example, the circuit of blood. Remember, it flows from the right heart to the lung and back to the left heart. From the left heart, it flows to the body and back to the right heart. In the heart, the blood flows from left ventricle to the body, back to the heart, and from the right ventricle to the lungs and back to the heart. In the fetus, the blood flow mainly bypasses the lungs because the lungs are essentially collapsed before birth. Oh, there is a blood supply to the lungs, but it's very small. Blood exits the right ventricle through the pulmonary trunk and the ductus arteriosus to the body circuit. The ductus arteriosus is a little connection between the pulmonary artery and the aorta. Blood from the right atrium into the left atrium, instead of flowing to the ventricles, flows through the foramen ovale, that little hole, the trap door between left and right atrium. At birth, a wondrous thing happens. At birth, with the first breath, the lungs expand, creating a low-pressure area. The low pressure in the lungs results in increased flow of blood through the lungs. The increased blood return to the left atrium causes greater pressure in the left atrium than in the right atrium, and it causes the foramen ovale slam shut. So, let's continue with part B, the structure of vessels. Let's look at our general scheme of circulation once again, but let's add two new vessels to the general plan. These will be arterioles, which are a specialized kind of artery, but very important, and venules, which are specialized veins. Notice the percentages given. The percentage of blood in the different components at rest, 7% of the blood is in the heart, 17% roughly in the arteries, including the arterioles. 68% is found in the veins and the venules, and about 8% in the capillaries. Notice that the huge amount of blood in the veins, something like 2/3 of the total blood supply. So the veins, in a way, act as a reservoir of blood. Walls of blood vessels usually have three coats or tunics. The innermost is the tunica interna or intima. It contains mainly endothelium and connective tissue. The middle tunic is the tunica media. It consists mainly of smooth muscle, which is mostly circular. It provides contractility to the vessel. It also has elastic connective tissue. This provides elasticity. The outermost tunica is the tunica externa. It's called the adventitia if it blends into the surrounding tissues. It also has, or it consists mainly of loose connective tissue. Let's look at the characteristics of the vessels in a little more detail. Arteries consist of two types, large and elastic ones. These are the ones that would be visible to the naked eye, and small, more muscular ones. These generally are not visible to the naked eye. All the arteries contain all three of the tunics, but the large elastic arteries have a well-developed uh, elastic connective tissue part, whereas the small muscular arteries have a well-developed smooth muscle component. Generally, arteries are thick-walled, they have a small lumen, and they're usually in a deeper location in the body. What about the arterioles? Well, they contain all three coats as well, but the best developed one is the muscular coat of the tunica media. It's extremely important. It happens to be well developed. It often contains a pre-capillary sphincter, that's between the arteriole and the capillary, to help regulate blood flow into the capillaries. The capillaries consist only of endothelium, but they're critically important because that's where substances enter and exit the blood. It's almost as though the entire system is designed so the capillaries can do their work. Venules are a little more complex than capillaries. They contain the tunica interna. The venules allow white blood cells to enter and exit the blood. And then there are veins as well as the lymph vessels. They also have all three of the coats, but in the case of these vessels, it's the third coat, the externa, which is best developed. They generally have thin walls and a large lumen. Generally, they're located a little more superficially than the arteries. They also contain one-way valves. By the way, the location, deep or superficial, is pretty important. The arteries contain blood under very high pressure. So there's a big risk that if they're ruptured, a lot of blood is lost. So they're located deeper in the body, less subject to damage. Let's look at more details. What is the role of the circular smooth muscle? Well, if the muscle contracts, what happens to the vessel? The vessel will constrict. If the muscle relaxes, what will the vessel do? It will dilate. What's the force causing constriction of the muscle? Muscle contraction. What's the force causing dilation of the muscle? Now, right away, if you're not paying close attention, you will say muscle relaxation. But how can relaxation of something act as a force? No, the force causing dilation is the blood vessel within the blood pressure within the blood vessel. Let's look at some other characteristics. The vasa vasorum are blood vessels within the walls of larger vessels. So you see, some of the big vessels need their own blood supply. Capillaries allow material to enter and exit the blood. Water-soluble substances pass through the spaces between the cells, the intercellular junctions. Lipid-soluble substances tend to pass directly through the endothelial cells, because remember, lipids dissolve in lipids, and cell membranes are made of lipids, the phospholipids. Interesting, each pound of fat requires something like 200 miles of capillaries. So a person who's overweight may impact the blood flow to the body. Permeability of capillaries varies. It's nearly impermeable in the brain. It's highly permeable in the liver and spleen. In fact, they're called sinusoids because they contain large holes, so a lot of material can enter and exit the blood. It's moderately permeable in the kidneys or in the villi of the GI tract. You'll understand more about these later. Also in the choroid plexuses. These vessels are called fenestrated because the capillaries contain small holes. Capillaries are the most common vessels. They extend from arterioles to venules. Other characteristics, let's look at the venules. The venules, we said, allow white blood cells to enter and exit, and that's because they're composed of what's called high endothelial venules. They're composed of cuboidal epithelial cells, and it makes it easier for the white blood cells to work their way between the walls. Let's look at some other characteristics. All blood vessels contain endothelium. As you now gather, it's a critical interface between blood and tissues. Endothelium has many different functions. It's not just a barrier between the lumen inside the vessel and the outside. It contains and secretes vasodilators, such as nitric oxide and prostaglandins. So you see, some of the endothelial cells act as endocrine gland cells. They secrete vasoconstrictors, such as angiotensin converting enzyme, ACE. You'll hear about that at a later time. They secrete anticoagulants, such as prostaglandins and heparin, and coagulants, such as platelet activating factor. What about the major blood vessels, Part C? This is a view of the overall circuit. It looks complex at first, but it only lists the very major blood vessels. There are many others that we'll refer to from time to time. It's a schematic view of the major vessels. There's the square heart in the middle. The organs are represented by capillaries, such as the pulmonary circuit, for the capillaries of the lungs, the systemic circuit, capillaries of the head, capillaries of the upper limb, capillaries of the spleen and stomach, capillaries of the liver, capillaries of the kidneys, and capillaries of the intestines, and capillaries of the lower limbs. Let's look at the overall circuit. In the pulmonary circuit, through the lungs and back, pulmonary arteries transport blood to the lungs. Pulmonary veins transport blood away from the lungs, back to the heart. In the systemic circuit, the aorta transports blood away from the heart. Notice the aorta extends anteriorly or superiorly toward the head, then curves and extends downward in the thorax and continues into the abdomen. Two important branches are the Brachiocephalic artery and the Celiac artery. The vena cava conducts systemic blood to the heart. The superior vena cava conducts blood from the upper part of the body. Two of its major branches are the brachiocephalic veins. The inferior vena cava conducts blood from the lower part of the body. The capillaries of the head are supplied by the right common carotid artery. This is a branch of the brachiocephalic artery. By the way, brachiocephalic refers to arm, head. The left common carotid artery arises from the aorta. The capillaries of the head are drained by the external jugular vein leading to the brachiocephalic veins, and the internal jugular veins leading also to the brachiocephalic veins. Capillaries of the upper limbs are supplied by the right subclavian artery that arises from the brachiocephalic artery, and the left subclavian artery that arises from the aorta. Yes, I know that gets a little confusing. Notice the three major branches of the aorta. One is brachiocephalic, one is left common carotid, and the third is the left subclavian. The capillaries of the upper limbs are drained by the right subclavian vein leading to the right brachiocephalic vein, the left subclavian vein leading to the left brachiocephalic vein. The capillaries of the spleen and stomach are supplied by splenic artery arising from the celiac artery and the left gastric artery, also arising from the celiac artery. The capillaries of the spleen and stomach are drained by several veins that come together to form the hepatic portal vein leading to the liver. Now notice the name, portal. Portal vein is a blood vessel that transports blood from one set of capillaries to another, in this case from the capillaries of the spleen and stomach to the capillaries of the liver. You may remember we had reference to another portal vein several units ago in the endocrine system. The hypophyseal portal vein transmits blood from a bed of capillaries in the hypothalamus to a bed of capillaries in the anterior pituitary. The capillaries of the intestines are supplied by the superior mesenteric artery, which is a branch of the aorta. Capillaries of the intestines are drained by the hepatic portal vein by way of some smaller vessels leading to the liver. The capillaries of the liver are then supplied by the hepatic artery from the celiac artery and the hepatic portal vein arising from the spleen, stomach, and intestines. Notice the liver has an obvious dual blood supply. One is systemic blood, we might say fresh blood, rising from the aorta by way of the celiac artery, and the other is blood in the portal vein, which comes from stomach, spleen, and intestines, and it plays a role in transporting digested and absorbed nutrients. That's a story for a later time. Continuing with the overall circuits, the capillaries of the liver are drained by the hepatic vein. It supplies blood into the inferior vena cava. The capillaries of the kidneys, however, are supplied by the renal arteries. They arise directly from the aorta. And the capillaries of the kidneys are drained by the renal veins. They lead to the inferior vena cava. The capillaries of the lower limbs are supplied by the common iliac arteries and drained by the common iliac veins, which again lead to the inferior vena cava. Let's trace the flow of a drop of blood in correct order from a source to a destination in 6 examples. List all the structures the blood would pass through, including blood vessels, heart chambers, and valves. We'll start, for example, from capillaries of the stomach to the capillaries to the right atrium. The blood will pass through the hepatic portal vein, through the capillaries of the liver, and through the hepatic vein into the inferior vena cava. From there into the destination, the right atrium. What about from the left ventricle, the capillaries of the spleen? Blood will pass through the aortic semilunar valve into the aorta, out the celiac artery, then in through the splenic artery to the capillaries of the spleen. Here's another one, from capillaries of the lung to capillaries of the left side of the head. Now that's a little trickier. From the lungs, blood flows through the pulmonary vein to the left atrium, passes through the bicuspid valve into the left ventricle. From there, the blood passes through the aortic semilunar valve into the aorta, and from there it passes in the left common carotid artery to the capillaries on the left side of the head. What about from the superior mesenteric artery, the capillaries of the lung? Let's begin with the capillaries of the intestines. Blood passes through the hepatic portal vein, through the capillaries of the liver, then by way of the hepatic vein into the inferior vena cava. Then the blood enters the right atrium, passes through the tricuspid valve into the right ventricle, from there through the pulmonary semilunar valve into the pulmonary artery to the capillaries of the lung. Let's try capillaries of the leg to capillaries of the right arm. The blood leaves the capillaries of the leg by way of the common iliac vein. The blood passes into the inferior vena cava, into the right atrium, passes through the tricuspid valve into the right ventricle, then through the pulmonary semilunar valve, through the pulmonary artery, then through the capillaries of the lungs, and returns to the heart through the pulmonary vein. Blood then passes into the left atrium through the bicuspid valve into the left ventricle, from there through the aortic semilunar valve into the aorta, and then the brachiocephalic artery, and finally the right subclavian artery, which would transport the blood to the right arm. Let's do one more. This one again is a bit complex. Let's go from the capillaries of the head to the capillaries of the liver. From the head, the blood would pass through the internal or the external jugular vein, then into the brachiocephalic vein, leading to the superior vena cava. The blood would enter the right atrium, pass through the tricuspid valve, into the right ventricle, and through the pulmonary semilunar valve. From there, it passes through the pulmonary artery, into the capillaries of the lung, and back through the pulmonary vein to the left atrium. The blood then passes through the bicuspid valve into the left ventricle, through the aortic semilunar valve into the aorta, exits the aorta through the celiac artery, then the blood flows through the hepatic artery to the capillary of the liver. And this is the end of Unit 18. You're now ready to progress to Unit 19, cardiovascular physiology.